Thank you. No problem.
Lisa, ready?
Yeah.
Lisa? Lisa, are you ready?
Yes, I am.
Okay, now the stage is yours.
Good afternoon, ladies and gentlemen. Welcome to another segment of the Compassion and Wellness webinar, organized by students of Master of Language in Communication and Digital Culture. I am Lisa Jandi, your host for today's discussion. For more information, you can access our Facebook page, which is Compassion and Wellness Webinar 2021 by Language Academy. And as a way of reminder, a certificate will be issued to those who are in attendance. An attendance link will be pinned on our Facebook page, on our Facebook comment section. You can also post your questions in the comment section and we will try to attend to them accordingly. With me here is Dr. Sivakumar, who will be discussing on dealing with loneliness and isolation amidst the pandemic. Dr. Sivakumar joined the Monash University, Malaysia on 1st of August 2006 as a lecturer. He obtained his MBBS from the University of Mangalore in India. That was in 1994. And he then went on to complete his Master in Medicine in Psychiatry in 2002 at the University Sains Malaysia. His special interests are in the field of psychiatry research as well as drug and alcohol treatment research. He is involved with Year 3 and Year 4 teaching of the medical program at the Kota Bharu campus. We pride ourselves in having him here as one of our panel members for this webinar. Thank you, Dr. Sivakumar, and over to you.
Thanks a lot, Lisa.
Thank you, Dr.
Thanks for that very kind sharing. It sounds as though I've been around for quite a number of years. But to be very honest, throughout those years, this is the first time that I've gone through such pandemic. So I thought when I was approached to talk about it, I thought that it would be a good thing to actually share. So in the next half an hour or so, I'll be talking about loneliness and isolation, especially now that we are actually facing the pandemic, and talk a little bit about how social distancing sometimes can be viewed as mental isolation. Now, connectivity is so important to us, as a population, as the human culture is basically, there is a very close need to be together, and togetherness means well-being and survival. So that connectivity is so very important. And now, in the COVID era, we find that that's being lost. And so before I start off, let's understand some basic definition that many of us basically use interchangeably, but falsely. When we use the word quarantine, we're talking about people who have been potentially exposed to a contagious disease. And that's where quarantine comes in. Now, the other term is isolation. So a lot of people use quarantine and isolation interchangeably, but it brings about a huge difference. Now, isolation is where you are separating people who have been diagnosed with a contagious disease. So it's a huge difference. So we are actually talking more about both, basically people who are quarantined and to a small extent people who are actually isolated. But you must understand that there is a huge impact of quarantine onto the human being. Some of the stressors, basically come from the duration. Like when we started off here in Malaysia, it started off for a couple of weeks, And well, it's gone on. I mean, obviously, we're looking at different types of quarantine, different types of restriction. There's this fear that goes on in people's mind whether, would I get infected? And you find that over a period of time, people are starting to lose this as things go on longer and longer. Now, staying at home is no big joke. Staying at home and not leaving, the frustration and the boredom basically comes into a huge problem. And when you can't go out, you don't get supplies. A lot of people whom I see in my practice, I'm a practicing psychiatrist, especially people who come from overseas, complain a lot about information. Much information in the country comes in the local language, and they don't get much up-to-date information. Of course, the huge part which we'll be touching on is how all this affects financial loss and stigma. Let's talk about social isolation. Now, loneliness, many a times, is defined by people's level of satisfaction, how well they connect with others, or what we can call as perceived social isolation. Now, why is isolation so important here to us? Now, we have never actually realized that until isolation has come in. 2020 was totally isolated from other years. 2021 doesn't look any different, actually. And without dwelling deep into it, a lot of people actually don't realize that isolation is actually strongly linked to mental health problems like depression, anxiety, and surprisingly, to cognitive decline. Why? We'll talk a bit about it, but it actually touches and affects resilience and factors that bring about resilience. Things like self-worth, things about sense of purpose, and feeling valued. So the big question is, how does isolation, how do you actually isolate a person and that reflects or translates to a mental health problem? Well, we're going to touch on this, but let's look at some hard facts that we've got from journals and research. Do you guys know that a lack of social connection actually is as bad or as dangerous as smoking 15 cigarettes a day or having an alcohol use disorder? And to be very honest, isolation is twice as harmful to physical and mental health compared to obesity. Now, many of you have never actually seen that and never made that comparison. Now, do you know that loneliness, just being lonely, can actually increase your rate, your risk of having a stroke or a heart problem by 30%? It can also cause a lot of premature death. And surprisingly, whether you believe it or not, 40% increase in a person's risk of dementia. Now, dementia is basically a cognitive thing. And these are not something that I've just conjured up. Basically, you've got your referrals there, and it's all from hard facts published in journals. We never looked at it because loneliness and the lack of social connectivity had never been a huge problem until 2020. What's the link? What's the link? When we actually look into research, you find that there's a close link between isolating yourself in terms of socially onto the changes that takes place in the body. Now, it's a complicating slide, but let me make it easier for you. People who spend long periods of time isolated from community or social find that there is a change in their white cell counts in the body. Now, what happens is white cell counts is actually used in the body or plays the function of basically a defense mechanism to the body. But when isolation takes place, you find that there is an increase in a lot of inflammation in the body, and there is a reduced action of antiviral response. So a lot of inflammation takes place. What I mean by inflammation is this excessive white cell count that goes on and a lot of white cell activity in the body. And this is very closely linked to mental health problems, especially depression and then anxiety. Now let's look how it's actually affected things around the world. Let's look at addiction. Now, do you know that 2020 basically saw the largest growth of alcohol sales? So, I mean, if you're running a shop selling alcohol, you must have made a ton. It's been proven that it actually went on and it sold as high as more than 22% in March. That was what UK has said. And remember that these statistics were taken in March, April, at the start of the pandemic or the start of the shutdown. And you find that it actually rose. People were drinking more. People were trying out new methods to actually use alcohol. And never heard of, something called the virtual bar, where people actually go online and drink. And they found that people were taking more alcohol than they ever need, and it was a new concept. The virtual bar basically allowed customers to pay first and drink later. So you found that people had thoughts about ordering their drinks and then having it a bit later. Now, why alcoholism? Why addiction? Now, a lot of reasons, the reasons that people have actually thought about is people started using alcohol as a coping mechanism. Why? To numb emotions. You find that emotions went haywire during this period of time, especially isolation. And the biggest change or the most significant change is relationships. You find that people don't go out, people don't meet people, people don't talk. So alcohol came in as a good substitution for relationships. And a lot of people used alcohol as a coping tool for stress. People had different ways of dealing with stress, and many of those were outside, especially people with addiction problems, had their group meetings, they had multiple counseling sessions with their counselors, and when that didn't fall in place, people started turning to alcohol and other substances as a coping tool. And well, the last thing is a lack of self-efficacy. They found that alcohol and other drugs basically help numb that guilt that they had. So one big change was in the field of addiction. Now, this is a packed slide, but what it basically showed was that teenagers in isolation, long periods of isolation, basically became resistant to something called extinction. That means when they started drinking, they were more vulnerable to keep on the alcohol for longer periods. They couldn't stop for some apparent reason, which basically translated down to subtle changes in chemicals and neurotransmitters in the brain. And that's exactly what we are seeing around the world. A lot of teenagers, an increased rate of teenagers starting to drink and finding it hard to rest the bottle. How has it affected psychiatric illnesses? So that's the big question, Do psychiatric patients experience more psychiatric symptoms during the lockdown? Now, this was a study done in 2020, that was last year, so not too far away, which basically looked at a group of patients with an already existing psychiatric diagnosis. And what they found was people relapsed. A huge amount of them basically relapsed into their old illnesses. Why? Due to some subtle reasons, some specific reasons. And the huge group of them basically were people who had anxiety. So people with anxiety, now that's the last group of people that you really want to lock down, because they sort of overcame anxiety by going out, by doing things, by overcoming the fear. But when you lock them down, they started relapsing. And a lot of depressive disorders also relapsed. Some reasons why they lacked self-resilience. A lot of people with mental health problems build resilience over a period of time. What is resilience? Now, resilience is basically one's own ability to overcome problems. And many a times, they overcame problems by speaking to others, by going out, by doing activities that sort of distracted their thought, distracted negative thoughts. And when the shutdown came upon, those activities were off limits, and people started having guilt. People did not have ways to be strong. They lost their coping mechanisms, a lot of them. They did not know how to cope, and it came with a bang. So the change was too fast, and people just couldn't find new coping styles. So a lot of them actually relapse. There was a total loss of structure in life, and that's something that we'll talk about a bit later. So a lot of people didn't know what to do. The best thing that you can do is just sit at home and maybe talk over uh, a laptop, a computer, and they stopped going out. They stopped doing the things they used to do, routine, exercise, talking to people, living their life. So a lot of people stopped living. And of course, that brings about stress. So those were some of the effects that led to an increase in psychiatric symptoms. Employment and suicide. Now, those are huge things. You find that what has happened is suicide associated with unemployment actually total about 9 times higher than suicide due to any economic crisis throughout the years. So there was, and there will continue to be, a very close link with suicide and unemployment. You see the local scenario, a lot of people who are working in Singapore basically lost their jobs. I see a huge group of them who are basically tied down in JB and just can't get in. And a lot of people who have basically been retrenched and don't know what to do. And this basically opens up depressive thoughts, depressive feelings, and suicide. How bad is unemployment? Now, nobody actually looks into those numbers, but let's talk about the high case scenario. There's been at least 24.7 million jobs lost. So the unemployment rates can actually increase from 4.9, about 5 to about 6%, and that's a huge amount. And all this increase in unemployment is closely related with an increase in suicide. You find that there is a statistic by WHO that states that every suicide we see in a population is actually closely accompanied by more than 20 attempts. So you're not looking at just completed suicide, you're looking at a high rate of attempted suicide. And sadly, from my sharing, when I practice in the hospital, I've also lost a patient during this COVID period. This was someone who was referred to me and admitted in the hospital with anxiety. And we acknowledged her anxiety. Her anxiety basically came about because she was cooped up at home, did not know what to do. Sad to say, she was a new mother, a first-time mother, and she had a lot of stress. No one to help her because people couldn't travel to come to help her. She had a husband, but he was working and he was busy. And when we sent her back home, she defaulted treatment, she defaulted a follow-up, only to have developed strong suicidal attempts, and she strangulated herself and was, they failed to actually resuscitate her. So that's sad, a new mother. And it's just one of the many losses that we have seen during this COVID era. This is something that many of us don't look at: violence against women, domestic violence. And we look into many aspects of changes, but many of us have overlooked this thing. And there has been a huge change in domestic violence in the COVID era. Local experiences, we have actually found at least a 57% spike in calls into the Women's Aid Organization. And of course, also a 44.4% increased call between Feb and March 2020. Worldwide, there's been drastically sharp increase of domestic violence all over the world. So some that I have just highlighted is basically just Asian countries, but UK has also shown a very tremendous hike or spike in those statistics. So you may want to ask why? What's the relation of isolation, COVID, and domestic violence? Well, remember that it's all linked together. When that happens, isolation is linked to mental health problems, and mental health problems basically is linked to domestic violence very closely. What happens is the perpetrator, or in most cases the husband, loses his job, gets depressed, develops a mental health issue, and does not know where to go, what to do, because there's a scarcity of community resources. Some of them get violent due to that. Some of them turn to alcohol and drugs, which basically perpetuates the act of violence. Let's look at young people and how has COVID actually affected this group of people. This is a study done in China, which basically experienced it first. And some of the young people had concerns basically around family health. Father, mother going out to work, teenagers were worried about school, university closures, and mainly they were also very worried about that loss of routine, the inability to go connect and meet friends and peers. So they found that the effect on mental health among young people, almost more than 80% of them quoted that their mental health had been affected at least a bit or much worse. What kind of things did they present? They basically presented along a lot of emotional problems. The young started having clingy behavior, irritability, worries. There were a lot of sleep disorders, a lot of nightmare, fatigue. And remember that this consolidated can actually translate to depressive and anxiety symptoms in the young children. Now, not to forget or leave out the elderly population, remember that as people age, the way they cope with life is so much different. It's so much different. And what has happened is a lot of coping mechanisms among the elderly have broken down. If you actually look at the culture around Southeast Asia, the elderly have a different way of coping with things, especially people who are retired. You find them going out in the morning, doing exercise, sitting down in that so-called kopitiams or coffee shops, having a chat with a friend, and that went for a walk when the COVID came in and when they were all locked down. Many of the elderlies were always reminded by newspaper and by the newspaper's announcement and TV announcements that they were at the highest risk of being infected by COVID. And that fear of that basically came in. I remember one of my clients, a gentleman who traveled to see me, and he had an exacerbation of his anxiety symptoms because he was afraid of actually getting out, doing things, the fear of getting COVID. So even when he had subtle respiratory problems, even a blocked nose, he started getting fearful and he would start having a panic attack. You find that loneliness hits this group of people worse compared to the rest. And of course, the elderly, we're talking about immunity, that's a bit doubtful. Stress, the defense system. And what keeps them in the fragile group is many of them are at high risk for being segregated or being abused, especially those who stay in old folks' home or rehab homes for the elderly. We find that during this period of time, because of the ongoing stress onto generally everyone, we find that these are the people who are the receivers of all that abuse, the brunt of the stress. This study, which was done in China during the early stages of the COVID, found at least 37.1% of the senior population experienced depression and anxiety. And the emotional expression or reaction of people aged 60 or more was very obvious. For some apparent reason, women experienced more anxiety and depression than men. But generally, throughout the ages, throughout the senior citizen category, all categories basically were affected by depression and anxiety. So when we ran through all those, you find that no one or hardly any categories were basically left out. Now the question here is, all these things are going on. So how do we actually deal with loneliness and isolation during this time? Well, there is no special formula to it. But the thing is, a lot of people have lost their structure in life. When the pandemic came in and when the lockdown came in, a lot of people stopped doing things that they actually were doing. And that's one of the first things that we keep telling people to continue doing at clinics. You must have a structure in life. So just because you're locked down at home and just because all your classes are online doesn't mean that you wake up late, doesn't mean that you do things any differently. So we keep telling people that mental health means structure. You must have that structure in life. So even though you're not going out, you're not meeting people, get up. Get up at the same time, maintain your wake, sleep structures. Keep a structure for your day-to-day functioning, study time, leisure time, and those things. So structure is so very important. Next to structure comes communication. I know when the lockdown happened, a lot of restriction took place, and that's where, despite all the negativity, there were positives. We learned new things that we could do that we never knew. We started teaching online, we started communicating online, and so communication doesn't stop there. So, a lot of people who basically felt cut off, we advise them, keep that communication going. You either give a call, you go on a Zoom, or you go on a teleconference and start talking to people. So don't lose that. Don't lose that. The only difference is you're not going out. Now, coping mechanisms. Coping mechanisms are so very important because it helps you cope with multiple issues, thoughts, stress, multiple things. One thing that we actually started teaching people was how to look into your resources, your strengths, your weaknesses, and see how you could change your coping mechanism. So, a lot of people who had initial coping mechanisms that were situation out of the house or in the community had to change their things. So a lot of people who went for meetings outside, who met friends, who went out to discuss with colleagues, had to do it from home. A change in coping mechanisms, keeping your timeline busy. Resilience. Now, resilience is something that doesn't happen over a day or two. It takes a period of time. So, resilience touches on a lot of things. It touches on self worth, a sense of purpose, and also being valued. And that's where people who basically lack resilience must be counseled, must be taught, a session where you could sit down and ask them to identify all these properties are actually very important. Stress. Now, people don't realize when stress hits them because stress is very subtle as it comes in. So, one good thing is to deal with loneliness and isolation is to identify stress. Identify where your stress is coming from and whether or not you are undergoing stress. And if you have identified it, then of course, coping mechanisms come in. Well, finally, last but not least, to help identify early signs. Now, I spoke about mental health problems. I spoke about changes. Now, that's where, you as students can look among yourselves, colleagues, family members, and identify changes, early signs of an underlying mental health problem so that this group of people can be taken or can be linked to a mental health practitioner so that something is done at the grassroots itself without getting it to go on further. So with this few strategies, this is not the end of the list. There are so many things that we can actually do, and I think it's good that we can actually discuss it later on. So in summarize, there are some mitigation issues that we can think about, some consequences of the quarantine. Keeping people isolated is going to be hazardous for people. Now, that's maybe one of the thoughts when the Ministry of Health actually decided to move or to change the criteria of the restrictions, because the shorter people are isolated, the better, the safer. It's so important that people are actually given information and given information as to what's happening, what changes are actually taking place, each step of the way. Because when people are not given that information, people get lost, especially the elderly. They have no proper source of information. Now we are all talking about the vaccine coming in, and a lot of the elderly are basically in confusion. They don't know who gets it first. They don't know when it's coming. They don't know the side effects. So these are things that should be given as succinct as possible. Structure. I've spoken about it, and I think I can't stop stressing on it. Structure in life, is so important, because only when you have structure, your coping mechanisms set in, your resilience come in. Of course, adequate supplies. Now, supplies would mean a broad thing about so many things. So it's not just food. Supplies may mean so many things. Boredom. Boredom is a step towards depression, towards anxiety. Non-communication, is hazardous to most people. Now we've got to keep that communication going, because the human race was never brought or never started off as non-communicating species. They always needed communication to work on. And of course, those of you who may be first liners or maybe the healthcare workers basically need some amount of special attention, something that because they're out there helping others. So with that, I'd basically like to thank you for your patience and sitting in through the session. I'll be happy to answer a few questions or to maybe hand it over to Lisa.
Thank you very much, Doctor. This was actually a very wonderful session, because we know that lockdown, which COVID-19 brought, is actually something that we're all experiencing it at the moment. So there are a few questions here that I will forward them to you. One of the questions is, how do we help people? And everybody's going through this issue of probably depression or feeling lonely one way or the other because of the lockdown. So how are we going to be able to help those who really are depressed in this situation? If all of us or a majority of us are going through the same thing, how do we help?
Yeah, that's a good question, actually, Lisa. Well, I'm going to keep my fingers crossed and hope that all of us don't get depressed at one time, together. There's first thing is that's a word that's been used quite interchangeably and many a times quite freely. Depression and depressive disorders. Now you and me can have depressed mood. So every now and then we get depressed because of changes that takes place in the in your surrounding or in the environment, and that's called depressed mood. So when something bad happens, my mood gets a bit down and I get a bit depressed, but I get over it. Within a couple of minutes, hours, or maybe a day or so. Now, when you're talking about depression or you're talking about a disorder, so you're talking about something that basically runs for a period of time, and we're talking about a consistently low mood for at least 2 weeks, something that has affected a person's functioning. So if you identify such things, and normally depressive disorders are not only mood, it's also linked with other symptoms like a loss of appetite, lack of sleep, loss of motivation, Some people have got suicidal ideas, which can be quite dangerous. So if you're identifying anything like this in friends, family, or people around you, the thing is, first step is identification, and then maybe sitting down, having a small chat with these people. And the best thing that any one of you can do is to get them professional help. You know, now a lot of people would think that it'll be I would be able to help this person or talk this person through. Now you got to be very careful with it. It's just the analogy of someone falling off a ship. And if you're on the ship and you jump off and you can't swim and that person can't swim, you're going to drown two people. The best you can do is actually throw them maybe something that you can pull them in or drag them in. So the best thing that you can do is first identify. If you feel that yes, you see a change in someone close to you, and you feel that it's triggering towards depression or anxiety, the best is to get them professional help. Professional help does not naturally mean a psychiatrist. You can basically also go meet a counselor, psychologist, someone who is trained in mental health.
Thank you very much, Doctor. So when we're talking of the feelings of depression, of loneliness, how do these come about? Does it just only come about as a result of being isolated from people, or is it a genetic issue, or how does depression actually come on?
Well, depression by itself can be of two types. One, we call it an endogenous depression. That means we're calling it from within. So that's the pure depression. That's the natural depression that takes place. But nowadays, in this new century, we are seeing a lot of exogenous depression. The word exo means from outside. So these are people who get depressed because of changes in the environment, like a relationship breakdown, a loss of a partner, loss of job, loss of finance. So the endogenous one, many a times, can be genetically linked. Depression is one of those few mental health problems or disorders which is very closely linked in terms of genetics. So depends on which type you're seeing, but symptoms are relatively the same.
So another question here I want to know is, does addiction lead to depression?
That's an interesting question, actually. Does addiction lead to depression, or does depression link to addiction? So we're talking about the chicken and the egg here. It's so very difficult to answer that, actually, Lisa, because many a times you see both sides. An example, an alcoholic takes alcohol, and in the long term, alcohol helps dampen their mood so much that they get depressed. Do you know that the statistics says 20% of chronic alcohol patients end their life in suicide? So you find that long-term addiction, yes, definitely people have got high risks of depression. Even people who are abusing methamphetamine, or commonly known as ice, in the long term it affects your brain, affects the cells, and can lead to depression, as not only depression but many other things. Vice versa, the other way around, can mental health problems lead to addiction? Yeah, because a lot of people with mental health problems turn to addiction to numb their feelings. If I'm anxious, I take something to calm my nerves. And what's the best thing? Alcohol or benzodiazepines, which are sleeping tablets. So example like that. So it's the chicken or egg story here, Lisa.
So, Doctor, in your opinion, how has isolation actually contributed to the depressive state of people currently?
Well, how has isolation actually affected or played a part in the depressive state? Well, just like what I presented, isolation has led to so many other things. It has led to a lack of connectivity. It has led to a breakdown in structure in life. It has led to decreased communication. It has led to decreased resilience in people, and it has broken down a lot of coping mechanisms. So it has worsened the depressive state of people with depression, and it has also increased or introduced depression in new people. So I would say that the rates are quite high, and where I sit and where I practice, we are seeing a higher rate of depressive disorders and anxiety disorders during this lockdown period.
So on a final note now, how can we help those actually feeling depressed in one way or the other, especially given the fact that we have SUP around us now? How can we be able to help those who are suffering from depression, especially for those that live alone, given the standard operating procedure?
Right. Yep. As I said just now, the main thing here is identify those changes. Simply put, I don't know how many of you are actually trained in mental health first aid, but a lot of people have gone through a mental health first aid course, and basically what a mental health first aid course is, it sort of introduces you to mental health problems. If you can identify changes, what I mean by changes is someone being, let's say, outgoing, friendly, social person previously suddenly stays at home, keeps quiet, becomes a recluse, those kind of changes. Now, something must be going on. So look for changes around you. Look at friends, family members, people around you who have changed, people who are no longer themselves. Now, don't take it for granted that everyone's changed. There may be something deeper underlying. Talk to them. Sometimes people with mental health problems are afraid or more so ashamed because of the stigma, and they don't voice out their opinion. All they need is a hearing ear. So talk to them and get them that professional help. Now, hospitals are open, mental health services are open. Most hospitals have also gone on to virtual clinics where we can actually zoom in and talk to patients or clients from their home. So you really don't need to step into a hospital or clinic nowadays.
Now, there's also another question, very important question here. There are people whom we find being very, very reluctant to actually talk about their problem. Or let's say they're in denial. They don't want to accept that they're actually depressed or they are having feeling of isolation. So how can we be able to help them in such situations?
Yeah, I think that's an important question, and many a times people get stuck. People get confused what exactly to do. Um, the thing is, to be very honest, when a person is in denial, as long as the person is still aware of his or her surrounding, he's not psychotic, he's not aggressive, there is very little that one can do. Very little that one can do. The thing is, there is a lot that would go against it. I mean, if you and me were to be in that situation, we'd most probably be in denial ourselves because of the stigma, because of what and how community sees, sadly, mental health problems as, a lot of people would feel afraid to go walk in and see a mental health practitioner. So it takes time. The thing is, you need to sit and to be there with these people. When I say sit and talk to people, I don't mean tell them things. Sometimes just sitting and listening or lending a hearing ear is as good as giving them 100% support. Many people have this false belief that when I go talk to someone, I need to talk, I need to counsel. No, sometimes silence says a million words. So give them time. The trust must come in. So once you build the rapport, the trust, and gradually, you can bring them out to see someone. Well, on the other hand, if someone is aggressive or totally psychotic, then of course that's really out of your hands. Then the police comes in to bring them to the hospital for care.
Sorry about that. I think we're having network. All right, thank you very much, Doctor.
You're welcome.
Very happy to have you here. This has actually been a very, very interesting section. We
Sure.
are really happy for you to accept our invitation to be here. And thank you, our audience. We're going to wrap up the webinar now. And thank you for your attendance. And please be sure to fill form pinned in the comment section. Thank you all for your presence here.